That warning from the Chief Medical Officer in Victoria is very concerning. Andrew reporting just now that he's hearing a shutdown. The third phase could come as early as today. Retail centres, Westfields and so on to be part of that. Would you welcome another step up in terms of the restrictions here?
Well, it's good to talk to you this morning, Kieran. Our view has always been that we need to be doing everything we can now. So whatever we're thinking about doing a week, 2 weeks, 3 weeks from now, let's do it today. Because that's the proper understanding of what we're dealing with. This is a virus which spreads exponentially, and you saw the very dire warning that was given by the Victorian Chief Health Officer about the way in which those numbers will grow. You only need to look at what the numbers are today compared to what they were last Sunday to get a sense of this. And every transmission that occurs, every extra person who gets this disease makes the problem from a public health point of view that much harder to deal with. So the logic actually suggests it makes much more sense to get on top of the problem as quickly as possible rather than to be following the problem up the curve, which is what the language of a proportionate response necessarily implies.
So in this debate about a gradual step down of social interaction versus a complete and total lockdown, you are much more on that harder, faster, that lockdown approach now.
Well, I'm not going to grab onto particular words here, Kieran, but it's simply to say this. For those who are sitting in the chair, and we're not, but for those who are getting these briefings day in, day out, who are being advised about what's possible and what's not possible and the kind of measures that might be taken in the future and might not be, let's not think about this in terms of proportions, because we're not trying to shape a human adversary here. We are dealing with a virus which spreads at a mathematical exponential rate. And when you think about a graph like that, then the more you can do before the graph takes off, the more likely you are going to be in actually managing the problem. And so whatever we're thinking of doing a month from now, let's do it today. I mean, that's got to be the principle that we're dealing with. And Andrew talked before about the border. I think he's right. The border is a very good example of, had we acted differently earlier on, then the scale of the problem that we're now trying to deal with would be entirely different and much smaller. It's got to be the signal for how we approach this going forward. And I think this really goes to the broader point, Kieran. I mean, I'd be the first to say that this is a wicked problem, and the sort of pressure that's being put on world leaders in terms of how to deal with this is immense. And that's the same for Scott Morrison and his government. I mean, it is a really hard problem for him to deal with, and we are fundamentally there to try and support him, which is why we passed all the measures that were put to the Parliament earlier in the week. But part of that support is obviously to use our voice, and I do think that what needs to be done here is a proper explanation to the Australian people, firstly about the scale of the problem that we're dealing with and its context, but also bringing the Australian people into the confidence of the government about what is the strategy, what's the guiding principle behind the decisions that are being taken here, with a view to what is the end game.
Do you think that Australia, speaking of the end game, are we in a position to get the outcomes seen in South Korea? Maybe not Singapore, it's probably gone past that, but those nations that have been able to flatten the curve, so to speak, or will it be worse than that?
Well, right now, we're not on. Our graph is not on the same trend line as those countries which have dealt with this the best, and it's why I think we need to have an explanation of what is the strategy and what is the play here. I mean, if it is imagined that a significant proportion of Australians are ultimately going to get this disease, then we are talking about a very significant loss of life and an enormous pressure placed upon our health system. If in fact the strategy is to try and get our foot on the throat of this disease and actually try and in effect stamp it out, if that is possible, but get to a point where transmissions are brought down to zero, and if you look at the numbers in Wuhan today, we're seeing virtually no cases coming through there now. If that is the strategy, then let's explain that. But whatever is the play of the government, Are we trying to do what South Korea is doing with its results? In which case, that would seem to imply, a greater measures in terms of social distancing, or exactly what is it that the government is trying to do? I think it's bringing the Australian people into the government's confidence about the strategy and the guiding principles behind which they are, on which they are seeking to make their decisions, rather than what we're seeing at the moment, which is a series of kind of iterative announcements every couple of days. Often they don't necessarily make sense. We can shake hands in the morning, but we can't in the afternoon. You can do haircuts for 30 minutes and then you can do them for longer. I mean, and part of why that story is hard to make sense of is because we're not being told what the ultimate strategy here is, and I think that's where the government needs to explain.
But it's not just the government, the federal government, it's the state government as well. And most would suggest that the National Cabinet has been a good reform. It's been one of the very few good things to come out of this. And yet you're saying that fundamentally there are some mixed messages and so on. But the general unity of purpose is a good thing, is it not?
Of course, and let me be clear, there is a unity of purpose across the country that's shared between oppositions and governments, that's shared between Labor and Liberal. I mean, Scott Morrison is trying to do the best he can. I'd be the first to concede that. He's and he is in the most difficult position that you could imagine.
And the Premiers too.
And the Premiers too, of course. So it's not... it's not about saying that people's hearts aren't in it. Of course they are, and they're trying to do whatever they can. But it is also trying to bring to bear, the best advice and the best voice that we can. And I thought Andrew's comments just earlier were really, really interesting about the way he felt his role as a journalist in respect of closing or having tighter restrictions on the border earlier on. I mean, the way he expressed himself then is certainly how I feel. There is an obligation on all of us to exercise our voice so that we get our views out there, and they need to be considered in the mix here. And it's not about doubting anyone's sincerity or anyone's unity of purpose. Of course that is there, and we're all in this together. And I think, political differences have melted away here, but it is about trying to make sure that our best ideas and our best thoughts about how we manage this are being put onto the table and being put onto the public table. And it is why I really implore those who are making decisions, and you're right, it's state governments as well, to explain what is the overall game plan here. What is the plan that we're trying to enact so that we can have a sense of understanding about where each of these announcements fit. And I think that's what's missing at the moment.
On to a couple of issues that we've seen emerge over recent days. The government looks like, as part of its third economic plan, to go to wage subsidies, direct wage subsidies like in Denmark, the Netherlands, New Zealand, the UK. You would welcome that initiative, but I guess the point is as well that this is a new system, so it might take a bit of time, like in the UK, where their wage guarantee is not being delivered until the end of April.
Well, we do welcome a move in that direction, and we've been concerned about the absence of a meaningful wage subsidy, and I think that the long queues that we've seen at Centrelink during the course of this week have been a function of an absence of a proper wage subsidy in the way things have currently been set up, and these were points that we were making whilst at the same time passing the stimulus, the relief package through the Parliament this time last week. But there does need to be a proper, robust wage subsidy so that there is an incentive for employers to maintain their employment relationship with their workforce during this difficult period, and you're not going to be able to do that unless you have a proper wage subsidy in place. We think there are mechanisms that can be put in place so that you do this in a way which is relatively seamless, but let's see what the government ultimately comes up with. But at the end of the day, if you don't have that there, well then there is not much incentive on the part of employers to keep their workforce on, and sadly I think that's why we've seen a whole lot of the really cataclysmic decisions that have been understandably made in the course of the last week, but which have resulted in so many people heartbreakingly on the queues of Centrelink.
Yeah, it is heartbreaking to see. Now, the government might need to come back to Parliament to pass this next package if it's more than the $40 billion envelope that was approved in Parliament in recent weeks. Isn't there a risk, though? I know Labor wants Parliament to return, but isn't there a risk if the parliamentarians do come back here? We've already seen 4 cases of MPs having coronavirus. Isn't there a risk inherent in that it would add to the spread?
Well, Parliament needs to be seen as an essential service here. That's how. I mean, obviously that's the case. There are decisions that have to be taken on behalf of our nation in a context of a fast-moving crisis, and so the ability to do that, I think, is critical. I think there are ways in which we can meet in order to do that, which are safe, and there are ways in which we can do that, which put in place measures that enable us to do it in a way that's safe. Certainly not talking about bringing back all the people who would normally make up the parliamentary contingent in a normal sitting week of Parliament, and that was even the case earlier last week. But there are ways we can do this without giving rise to significant risk. You only need to look at the efforts that are being rightly put in place to enable our health workforce to do its work, making sure that the proper decisions which guide us through this crisis has to be seen as an essential service, as an essential part of how we manage this.
The new quarantining measures came into force last night. I know you've already discussed this, as did Andrew earlier, the debacle around the Ruby Princess particularly. Defence will play a role in ensuring these quarantines are honoured and respected in the various hotels where people will go. Do you see a greater role, an increasing role for Defence as we battle this pandemic?
I do, and we've been calling for that for some time, Kieran. I think the Defence Force has a very significant role to play, and to be fair, that it is already playing a pretty significant role in helping make surgical masks through to the planning capability that Defence has. I mean, Defence is many things. One of the things is it is an incredible planning organisation, and its planners are now embedded in various state control centres around the country within the Department of Health and the like. I mean, there are a range of ways in which Defence can help, but one of the points I would make is that the very presence, the reassuring presence of the Australian uniform within our community in the midst of a crisis has value. We've seen that during the bushfires. We saw that in crises that the country has faced previously. I think that alone is going to make Australians feel better. And so it is very important that Defence has a significant role to play here. It's of course critical they're not politicised, and we saw where that went during the bushfire crisis, but having the Defence out there loud and proud is, I think, a really important step forward, and there are many, many roles that Defence can play.
I want to ask you the bigger picture now, the broader geopolitical relationships between the major powers in the world and the impact that this crisis is having on those relationships. It's straining and will continue to strain international, postured relations. Richard McGregor from the Lowy Institute told Paul Kelly in The Australian yesterday that China might actually, amazingly, emerge from this crisis more strongly than the United States. How do you reflect on that?
I think it's a really important observation, and it's the next discussion that's going to be had here. This is first and foremost a health crisis. It's obviously had a major impact on our economies, but this is also in time going to rewrite the strategic landscape of the world, and how this then impacts our national security going forward will be, the next way in which we think about this. And it's hard to know exactly how it is going to rewrite that landscape, but it's hard to imagine that it won't to a very significant degree. And what I think will be critical here is that those countries that come through this best are going to be in the best position to take advantage of whatever that new strategic landscape looks like. And so it's not just an imperative in terms of our health, although it obviously is, and our economy, although it obviously is, but it's really an imperative from the point of view of our national security that we are able to deal with this as quickly as possible and get through it in the best possible way. And we've got to be very alive to that.
So from that global outlook, I want to bring it back to the very local and if not the home, and as the Prime Minister is going to do today, I want to get your thoughts on his commitment, $1.1 billion for mental health, domestic support, domestic violence support services, and also about $700 million for more telehealth services. What are your thoughts on this various the elements to this package to be announced today?
We've been for some time making the point around telehealth that has to happen, getting to a position where we're taking people out of the waiting rooms of doctors' clinics, and doctors as much as possible are able to do their work over the phone and be appropriately paid for it is a critical part of how we're going to get through this. So we're pleased to see those developments in relation to telehealth. And you're right, the mental health impacts of this are very significant. This is a really scary time, and it's obviously having an impact on people's mental health. And domestic violence is of enormous concern as well. And so we need to be covering off all of these aspects, and more attention on each of those is very much welcome also.
Richard Marles, as always, appreciate your time. Thanks.
Thanks, Kieran.